Okay, so welcome, Dr. Ashok. Welcome, Dr. Gajanan. It's lovely to have you. You two are, two of the most popular trainers in the TQFS Academy, and people would love to hear from you. So today, the main reason I've invited you is to talk about the management of COVID. Now, we realize it's a huge, big thing at the moment in India, and numbers are increasing. So we just want to get behind the scenes, and also how are homeopaths, contributing to this whole epidemic, and what exact role they are playing. So Ashok, I'll start with you first.
Okay.
Talk about just your experiences. What's, the homeopathic perspective here?
See, Shilpa, I stay in Goa. Okay, Goa is a very small place.
Okay.
And this COVID started in Goa very late, almost 5 months after it started in Mumbai maybe.
Okay.
Okay. So I have seen maybe till now about 70 to 80 patients. And there are all types of patients. There are some who have mild symptoms and they get better within a day without medicine also. Okay.
Yeah.
Then there are some who have stronger symptoms. And let me tell you, the most common symptoms we saw in Goa were loss of smell, taste, a lot of body ache, great weakness, diarrhea for a few days, and fever.
Okay.
These were more or less common in all. So some are very mild, they get better on their own without medicine. Some are a little stronger. They have fever for 4 days, 5 days, 6 days. They get better within a week. They need the medicine, whatever we give. There are some who have difficulty in breathing, who have pneumonia. And these patients usually go to the hospital. So in the hospitals, the allopathic treatment is also started and they continue our homeopathic medicine also. And there are some patients who have a lot of comorbidities. Okay. And they also develop this. So this is the, generally 4 type of categories I have seen here in Goa. But let me tell you, everybody got cured. Nobody died.
Okay. Wow. So that's 70, 80
I was treating with homeopathy. Nobody died. So in Goa, we see about 7 deaths in a day. But they are those who are not on homeopathy. So that's the, good thing that under homeopathy, nobody has died till now.
Wonderful. So, Dr. Ashok, talk about, so how do you take a case? Like, what do you really look for? How do you manage the patient? What do you communicate with the, just the family as well as the patient?
See, the case taking is as you take a case in any fever case. Okay. You first ask, tell me what is the problem. Listen to the patient first. Because the first few symptoms which come, which are spontaneous symptoms without asking any specific question, are the most important. Okay.
Okay.
So that is, we first ask what is the problem, note down 1, 2, 3, 4, whatever the patient says. Then the patient has finished talking. Then you ask about the generals, always. Thirst, thermals, perspiration, stools, urine, these things.
Got you.
Next to ask is the state of disposition, whether he is active, moving around, sleepy, or stuporous, restless, or just wants to lie down in one place in bed. These are questions we ask, to bring us closer to the remedy.
Got you.
Okay. And once you have the picture, then you see whatever is common in all patients. So you keep that aside. Pick out those 2 or 3. 1, 2 or 3 peculiars which no other patient has, and which will indicate the genius of the remedy. Okay. So, for example, I'll tell you, if the patient is having fever but doesn't feel feverish, but fever is high, temperature is high, or the opposite, he's feeling feverish but no temperature. And now this combined with dry mouth and thirstlessness is pulsatilla. Okay. 2 or 3 symptoms. The most peculiar ones, we pick that out and we prescribe on that. And what I saw, in this epidemic, it was no different from any other influenza which comes every year. And the same remedies which are used every year are coming up. Bryonia is the commonest. phosphoric acid is the second common.
Okay.
Pulsatilla, Gelsemium, Eupatorium, Rustox, the same remedies, more or less same.
Got you. So how do you, dose the patient? How do you, determine what sort of posology you use?
Okay, in all my COVID cases this year, I have used only 30 potency.
Okay.
And what I do is I give 3 hourly 3 doses. Okay. This is my first day cut dose. Usually they are fine next day. And then I don't give anything else. Some patients who are a little more showing more stronger symptoms, they need a second or a third remedy.
Okay.
So I've given Stanum as the first dose, and then after 2 days Pulsatilla, and sometimes a third remedy also. So states have changed. So it's not always it's one remedy. It's sometimes 2 or 3 remedies.
So do you follow up the patient every day?
Yeah. These COVID patients, I am following up every day. Every day. One more thing I want to tell you. Maybe it is my experience, okay?
Okay.
So last year, when there was influenza is there in Goa every year. Every family gets it. Okay. So all these years, for the first 28 years, I was not getting that good satisfactory results. Okay. Some would get all right, some would not get all right. So last year I started a new thing. I gave influenzinum 30 to every patient along with the acute remedy. So it's Pulsatilla 31 dose. After 2 hours, influenzinum 31 dose. 3 doses, 3 hourly. That worked very well last year. Okay. Wow. So same thing I did with COVID this time. Same thing I did with COVID. So I've given influenzinum 30 as a specific nosode, and I have given the indicated acute remedy. This has worked very well.
That's very right now. So the influenza nosode is working for COVID patients as well.
Yeah. And I think you should read Clark, okay, for this. And also read what P. Shankaran writes about influenzinum.
P. Shankaran is...
They have written the same things. Yeah. P. Shankaran.
Okay.
So, they have also written about it. So I tried it out. It worked well.
Wonderful. So it's like you use the influenza nosode and then you use the indicated medicine. So every 2 hours you're alternating.
3 hourly 3 doses is my starting, and afterwards only if required.
Got you. Okay.
There's one more thing I did. Now, those who are having breathlessness, I have given tuberculin 10 ml as the first dose. Because see, the pathology of tubercular miasm is, or tuberculosis, the disease is inflammation. First is infection with the bacteria, then inflammation, and then fibrosis. So what we see is fibrosis in the serious patients. So to prevent that, for those patients who are very serious, having difficulty in breathing, I have given tuberculin 10 ml as the first dose and then started my medicine. Okay.
So Dr. Ashok, when they are on homeopathy, how many people went into complications, or what do you do to, avoid that? Or when they go into complications, what's your management like?
Hardly anybody went into complications. Nobody, I can say, when we started off early. Now, some patients contacted us directly from the hospital.
Okay.
Those who were already in having pneumonia.
Got you.
Okay. Yes. So they were handled in a different way, but those who were put on homeopathy right in the beginning, nobody went into complications. Even those who had comorbidities.
Okay. So comorbidities would be people who are, a heart patient or diabetes or, people who have other issues that are risk factors for COVID.
Yeah. In fact, severe comorbidities. Somebody who's on chemotherapy. Chemotherapy, you feel that immune system is down. But I have given arsenicum, the patient recovered completely. Old lady of 75 years, she was. Wow. Another was a lady who was a renal transplant patient who again had renal failure and is on 20 medicines. She is an asthmatic and highly compromised on steroids and a lot of things. She got this. First dose was TB10, then Stanum, and then Pulsatilla. Then she was okay. After she recovered, again she required Stanum. Completely recovered. So even though the one was a patient with cardiomyopathy and his heart was not contracting. Okay. And the day I saw him first 5 months back, I thought he will pass away next day. Okay. Because he was edema, swollen all over, breathless at rest also. Then he improved nicely and then he got this. but he improved very well.
Wow.
So it's, even serious patients have got all right like this.
And even
Those who
people
had comorbidity.
on multiple, immunosuppressive
Yeah,
medications have actually responded to homeopathy.
yeah. Yes.
Wow. So Dr. Ashok, this is really, really inspiring. And, people are scared. People don't know. And sometimes, they are too overwhelmed with such a lot of information going around with COVID, homeopathically as well, use this, use that. So it's like, I can see the baseline is keep it simple. And there are 5 or 6 important remedies that come up. Make sure that you know them well. And that's exactly how you use them. Is it? So any parting words for people, new people who want to take on and, a COVID patient, what would you tell them?
Yeah. I want to say something here important because I think this is required. Apart from what I said just now, that give influenza NM 30, give the acute remedy required, watch out for change in state to change the remedy. Apart from this, I want to tell something. Social media all the time is talking about wear a mask, wash your hands and all these things. Now let me tell you, this COVID can affect anybody anytime. So the only thing we can do is to keep our immunity good. And the way to keep your immunity good is, number 1, breathe enough oxygen. Number 1. Number 2 is, drink proper water. Third is sleep well. Fourth is eat well and have a healthy lifestyle. But that breathing oxygen is very important. I have seen people wearing a mask inside their house also all the time. Now my experience, all those who are wearing masks all the time have got COVID. And those who are, relaxed at home, breathing in fresh oxygen, they have been safer. And my staff, I tell you, my staff were in masks all the time. All of them got influenza, though not COVID. All my doctors who work for me, all 6 of them got. If you're going into a group of people, then you have to wear a mask. You have to protect yourself and the others. When you are with other people, in a group of people. But when you're driving a car alone in natural surroundings, you don't have to wear a mask. Please breathe the oxygen. But people are doing that out of fear. So this is what I want to tell. Breathe natural oxygen as much as possible. Don't wash hands all the time. One of my patients, the child fell sick. Then I asked what happened. She said, no, because of COVID, I make him wash hands every 15 minutes. The child is 6 years old. Every 15 minutes washing hands. So this is overreaction. So we have to be a little, use our common sense and do something which will be good for us. Yeah. That's all I have to say.
Oh, thank you so much. That was so vital, Dr. Ashok, because there are over anxious people who are like wearing masks all the time, even when they're on by themselves. And there are people who absolutely don't disregard. There are 2 extremes we get, but
two extremes.
Having a balance, knowing what exactly is the role of a mask, when do you need it, when do you not need it. So this was really helpful. Thank you. So that was good. Thank you so much, Dr. Ashok. So I'll now move on to Dr. Gajanan. Hi, Dr. Gajanan.
Hi, Shilpa.
Okay. So tell us about, you are, the king of acute remedies in our academy. So I want your experiences and just on COVID and just right from the beginning, your first case and how did you, start off treating patients?
Yeah. Actually, my stint with COVID started the time when first few patients started entering India, in fact, in Mumbai. And we were hardly knowing anything about COVID because we used to only know by reading in the online literature what we had.
That was in February, right?
That's in February. And accidentally, one of my patients who had been to Dubai came to me and she started showing symptoms which I started matching with my patients who had this problem in the online literature what we had seen.
Okay.
So what happened is I thought that maybe she is having COVID. So there was only one infectious disease center in Mumbai that was functioning at that time. So I sent a patient to that center and immediately I got a call saying that your patient is COVID positive. And if you know that empty, hollow, all gone sensation that we go through, okay, I had the same experience myself because I had handled her for 2 days. So we were summoned there and it was actually a blessing in disguise because I had to stay there for 24 hours and watch these allopathic physicians work, how they manage COVID cases. We were tested negative, but these 24 hours made me understand the way these allopaths were managing these cases. So when I came back, I started making myself ready for this to come. And I think within first 15 days itself, we started having patients of COVID coming positive. And since I had so much of association with the allopaths, we had co-referrals, and even we took permission to work with the allopathic authorities. So there were some government hospitals where we got an entry to. So we could see patients firsthand. We could see patients who had been on allopathic treatment. So we were there as a co-treatment along with allopathic physicians. Then we were also managing some serious cases. So in this last 6-7 months, we could manage around 400 to 500 cases of mild, moderate, severe, and critical. So now the experience is quite huge, I feel, at this moment, that we could manage most of the cases well with homeopathy, as in so many cases also we did not have any morbidity where the patient succumbed to the illness. So that was a good credit that we had with homeopathy, and even the allopaths started referring patients to us, especially those cases which got stuck. So by now we could have a lot of array of patients at the same time, symptoms and an experience to share. And I feel that we homeopaths can do a slightly better job than our the other halves, I mean the allopaths, in most of the cases, and especially in complicated cases also. Okay, so that's the way I started, and it's going well right now also.
So Dr. Gajanan, what is it that you do when you see a COVID patient?
See, now I have a team of homeopaths who are working with me for COVID, and the thing is, we have made a kind of protocol for case taking. The most important is the diagnosis. There are some clinical features on which we diagnose that this patient is COVID, because many a times the COVID test will come negative,
Okay,
and the patient may still be positive, or there is a chance that the patient may not do the test and will come to you.
Yeah.
Okay. So there are few features on which you should know that this case is COVID only. Okay. So once you know that it is COVID, then you have to divide into 4 categories. That's what I feel: mild, moderate, severe, and critical. The severe and critical, they will be referred to you, but the mild and the moderate will not be referred. They can come to you directly also. Okay. So the mild and the moderate cases, they come to us directly. The severe cases, they come to us through references. So once you know that this is a mild case, the cases generally, just to tell you to all our friend homeopaths, the ones who lose smell, the ones who lose taste, they are a blessing COVID, in the sense they get COVID positive, but they are going to get cured. Okay. There is no way that these patients go into any kind of complications. They stay in this carrier state for a few days, and afterwards they completely recover. Okay, so in such cases, even if a patient gets COVID, the first thing you tell him as an assurance that you will be all right and you will not go into a complication. So these cases are blessings, and these cases, a single remedy of the indicated medicine based on peculiar symptoms will always cure him, always. Okay, and if you get such cases, you consider that you can make a case of yourself because he's going to be all right.
Wonderful.
Next cases, they come are the moderate ones, where there is slight fever and slight respiratory distress that has started. Okay, now this respiratory distress that you have started, you should use a pulse oximeter. Everybody, like the way we have thermometer with us, the patient has to be told that you keep a pulse oximeter with you. Anything that is going below 90 needs oxygen as a supply, so that they stay getting out of breathlessness. They don't stay breathless. So you need to have that pulse oximeter. And when we take follow-ups, you have to take the readings of his respiratory rate, his pulse, temperature, and oxygen concentration. These 4 things are the most important. After that, you take all your symptoms. The symptoms on which you prescribe will be the peculiar symptoms, which are the most characteristics and what are presenting in front of you. An advice to all the young practitioners is, don't dig deeper into the case. see what is there predominant at that time and prescribe on that, you will be successful. But if you go into deep history taking and try to derive some mental state and prescribe on that, maybe you may have a failure, especially if it is a moderate and a severe case. And if you have prescribed on a heavy mental in a mild case, I will tell you that it was as it is to recover. So that credit may not go to the remedy, because that is the way the prognosis is. Okay. So in moderate cases, follow this as a protocol. Keep your tab on the physical generals the most, the peculiar symptoms the most. And if you are following these symptoms, then your chances of prescription are going to work is for sure. When it comes to severe cases, in severe cases where the oxygen level goes below 90, that's a time, that is a critical time for you as a homeopath, because you will be an adjuvant therapist also, but at the same time you will have to change the remedy, because the remedy change generally comes in the moderate, severe and the critical cases. The state doesn't remain the same. There is something that I have found is how to correlate your investigations, especially in moderate and the severe cases. Like if a patient comes to you with just tested positive COVID, and if his D-dimer levels, if his ferritin levels are very high, I have given doses of merxanatum or totalis so that they do not go into hemorrhagic changes. And we had considerable reduction of patients going into complications who would have otherwise gone into complications. Statistically, those patients who did not receive these kind of medicines went into complications of hemorrhage and other problems like respiratory distress. But such patients where I could see and foresee his neutrophils being high, his ferritin being high, if I can give a preventive dose, like how influenzinum works in the first stage in the mild cases, that is an excellent prescription. You use influenzinum, it will abort the attack of fever and it may not go ahead. Same way in complications where the patient is going into a hemorrhagic problem or any other complication, merxanatum, ferrum phosphoricum, these have prevented the patients from getting into complications. So this is in the moderate and the severe cases. In critical cases, especially where the oxygen depletion caused the patient breathlessness, in such cases we could get the patient out with aspidosperma, vanadium and anti-Mars, anti-Tart. They did miraculous job of getting the patients out. So of course the patient was on oxygen therapy, patient was having steroids, but it was not coming up. And that is the time we interfered and got the patients out. And it was actually a wonderful experience treating in all levels. So the first message is segregate your patients into mild, moderate, severe types. If you are really good clinically, handle the rest too. If you feel that this much is okay, then handle the first two groups. You will be surely successful.
Oh, that was so fascinating, Dr. Gajanan. Thank you so much for sharing, because that is one major, anxiety in cases and with family is the patient should not go into complications. And, so we have remedies that actually stop that process and reverse and keep them in that mild, moderate state. So how do you work the posology in such cases? How do you manage those dosings?
The initial cases where the patient was in the mild stages, 30 potency has worked. But when it is a moderate and a severe stages, I had to use 201 m and even frequent repetitions. Yeah. See, I'll tell you some cases which are severe ones. The mild ones will always have many mentions in different homeopathic seminars, but the severe ones are those which took our breath away when they were breathless. There was an old man who came to me at night, 8 o'clock, with oxygen concentration gone down to 46, 47. And he did not have a place in the hospital. So it was told for us to manage that case till the time he finds a place in the hospital. Okay. And he couldn't give symptoms because he was already on oxygen and he couldn't speak. But on observation, we prescribed him maybe anti-Tart once and vanadium. In repetition, we kept him okay till around 24 to 36 hours till he finds a bed. Okay. Oh. He goes to the hospital. In 4 days, he recovers to an oxygen concentration of 85. Afterwards, he exhausts his money. In 4 days, the bill went to 4 to 5 lakh rupees. which was unaffordable. He comes back with the oxygen concentration 88. From there onwards, we again managed him with same homeopathic remedies and got him out, and he's completely all right now. But I still know what happened to us when we were seeing the patient at 46. At any moment, he could have popped off. We had kept the camera on him, just observing the whole night. One of my assistant homeopaths, she did an excellent job in observing and changing the medicine frequently in potencies, same potency, and the patient really came out well. Similar case was of my friend. He's a general practitioner, and he was admitted with severe breathlessness, and his concentration was at 80, 88, and he was on complete allopathic medicines. So at one point, he called me saying, please save me, nothing is working for me, and my concentration has gone to 82 now. And I asked him only one question, what do you have? And he said, I feel breathless, and now even breathing at normal is very difficult. So I told, do you sweat? He says, I sweat severely when I cough, though nothing comes out. I started him on antim-tart, 1 ml every 10 minutes, aqua doses. Within 3 hours, this patient who was on this concentration for the whole day, in spite of allopathic medicine, in 3 hours he called and said, I'm walking now.
Oh.
I could walk properly. And that was miraculous for us. That was really miraculous. So many cases had miraculous result as an adjuvant therapy also. And the mild and moderate cases, I feel we can do really wonders if we just focus on the presenting symptoms of the case.
So Dr. Gajanan, this is very important because in those severe cases, you're actually using very high potencies and much frequent application. Is there any reason for that?
See, first of all, we had very less experience in handling COVID. Okay, but what I understood from the pathophysiology of COVID is that the patient deteriorate rapidly. You understand? And if the patient is deteriorating rapidly and we don't know which is the system that is going to get into complications the next. I'm talking about the critical cases. Okay. So it is like war. I have to do anything to salvage him. Okay. The allopaths have already put him on so much of steroids and the antivirals that it doesn't help the patient from it doesn't help the patient to come out of the case. So if there is a rapid deterioration, then the higher potency in frequent repetition in aqua potency helps. Means if I have given 1M, the next will be 1M plus 1, 1M plus 2, 1M plus 3, 1M plus 4. That has helped in severe cases. I can't give one dose and wait because I don't know next what will happen. Okay. So that is what my experience in the severely, rapidly deteriorating cases. So in those cases, the higher potency have worked. But we as homeopaths have been taught to get scared of higher potencies. Okay. But somehow from my constitution, that fear has gone. It doesn't exist. And now last 25 years, I have been using these high potencies in rapidly deteriorating all pathological cases in plussing method, and they have really helped a lot. But if it's a chronic case pathology, then a lower potency or LM potency will help you.
So in an acute, rapidly deteriorating pathological case, you use higher potencies. However, in a chronic case that the susceptibility has already gone low, you use a lower potency.
Low potency.
Thank you so much, Dr. Gajanan. That was so helpful. And, Dr. Ashok, just, coming that positive energy and just excites everyone and inspires everyone. So what are your parting words, Dr. Gajanan, for people who are taking on COVID cases?
I think that they should go right head into it because you have good results. And the most important thing, message which I want to tell them is the simple remedies work. Don't complicate yourself by going to the complicated remedies. The simple remedies with taking simple symptoms have got the patients through. The only thing what they need to do is monitoring the patient well, for which you make a kind of protocol. As what Dr. Ashok says, daily follow-up is very important because we need to follow the patient not for the whole life, only for 15 days. Within that time, the patient generally becomes all right. Another thing which I want to tell you where homeopaths can really score is the post-COVID affections and COVID psychosis. In COVID psychosis, you can go into the depth and the constitutional remedy will do it. But in post-COVID complications like fibrosis, we have had pathological reversals with homeopathy. So those are your cases. This is where you can score and the world is opening for you. Because after COVID, the commonest people who did not know of homeopathy have started resorting to homeopathy because they did not find a complete answer.
Got you.
So all your residual problems that are left after COVID that can be treated well with homeopathy. The first mild and moderate cases can be treated very well with homeopathy. And the complications, they also can be treated very well with homeopathy along with the psychosis. So you have a big playground open now. Don't get scared. That is the only thing which I need to tell you, that don't get scared. If you are scared, then you need to take your own constitutional remedy. Homeopathy will always work unconditionally.
Oh,
There is one more thing I want to say, Shilpa.
Yes, Dr. Ashok.
And now, because he talked about this, there's one more thing I have been using. See, there are two things. One is lot of fear is still present in minds of people.
Absolutely.
And it's fear psychosis. It's not simple fear. Okay. So this causes a lot of disturbance in the immune system, this fear. So one of the blockbusters that I've used is cortisol 200. Okay.
Okay.
As a blockbuster, if you're getting blocked, sometimes that fear, with the fear, cortisol levels go high.
Yeah.
Second is because of wearing mask constantly, oxygen levels become less and cortisol levels go high.
Yeah.
So now people are coming with diabetes, hypertension, young people, acidity, all steroid symptoms, That is because of higher cortisol levels. So this is one of the remedies which will be used as a blockbuster whenever you get stuck. I'm dealing with post-COVID.
Post-COVID syndrome. So,
Yes, post-COVID syndrome, you'll get this a lot. And you will get a lot of fibrosis and a lot of cough that will come up afterwards.
wow.
You will get rheumatism, joint pains, residual after COVID. That is another thing that may come up. There will be a lot of weakness and chronic fatigue syndrome. That these people, they are not able to make up after some time to the lost energy. So these patients will come up a lot. So you need to even follow up for a longer time. Second thing is you keep the patient on treatment for some time so that the patient completely recovers, especially who has had severe infections.
Yeah.
Okay, so maybe at that time your constitutional remedy may help you. But to get the complications out, the indicated remedy on the presenting symptoms, that is the only mantra.
Got you.
There's one more thing I want to add, Shilpa.
Yes, sure.
When we talk of COVID, people think only about fever and try to find out the symptoms of the fever,
Mm-hmm.
That's not the only thing. Sometimes it is the modalities of the headache which lead us to the remedy. Sometimes it is the tongue which leads us to the remedy.
Yes.
Okay.
Yes.
So it is not only the fever, the chills, the sweat and the stupor around. It's not only that. For example, I tell you, this I was telling you about this patient who had a renal transplant. She was on a lot of medication. So I gave her tubulin first, then stanum, then pulsatilla. Then after about 10 days, and she has a D-dimer was increasing all the time. Okay. So that means chances of thrombosis.
Yeah.
Then again stanum required after about 15 days. Then she comes with a tongue which is dry, swollen and white. Absolutely dry. I have a picture of that which they sent me. And lot of weakness. And this was a muriatic acid tongue. You go and read muriatic acid in Allen's keynotes or boric. Dry, absolutely dry, white coated and swollen almost. And muriatic acid worked very well. So like post-COVID, after getting all right, such symptoms come up. So we have to follow them up for some time.
Got you. So we will have a whole syndrome of things happening, not been well since COVID in a way. And it's all about, isn't it? And we still do not know the expanse of what it is because it's still early days in a way.
Yes. So this post-COVID things is the thing that we need to strengthen ourselves on. So you have to gear up yourself with a few set of remedies which will be helping the patient after COVID. So not well since and not well since pneumonia, post-influenzal infections. So you will have those remedies that will be coming up again and again in your prescriptions later. So those things and watching the peculiars. That again, I am telling you, watching the peculiars will be the whole thing in your prescription. So watch the thing which is happening in front of you,
Absolutely.
in your front of your eyes, and that observation will crack your case. And even if it's a severe case, let it be a severe case. Don't get scared. You will see something, that's for sure, and that will see you through. Okay. Another important, the nutrition part is very important. You always tell the patient to have good nutrition. Of course, plenty of water, steam inhalation, and the deep breathing exercises. The pranayams have helped a lot. So the treatment should go along with lot of pranayams, exercise, good nutrition, plenty of water to drink, vitamins. Please don't get the vitamins out of it. These things together with the medicines are very important. So one small part to your consultation should be the adjuvant vitamins and the other things which I just told you. So this has to be included in your treatment.
Perfect. Got you. Thank you. That was so helpful. Just bringing it all together, and so people who are listening, we have a whole spectrum of things, right from the fever or first loss of taste to the complications that last for months together. And so if you would love to know more about Dr. Ashok's work, Dr. Gajanan's work, we are running a special discount for all their courses, and they have a spectrum of different things, right from how you work with COVID cases to managing the acutes to, complications, pathological aspects, rheumatic issues. So if you would love to, join them, they would love to take, and coach you from there. But thank you so much, doctors, for sharing all your wisdom, and where would we without you? So that's wonderful. Thank you, sir.
Thank you, Shilpa. It was very nice talking to you.